Welcome everyone. I'm your host Shania Prasad, and today we will be discussing Budget 2023 and its allocations to the health sector. And no better persons to have that discussion with other than the experts themselves. With us we have the Honorable Dr. Frank Anthony, Advisor to the Minister, Dr. Barry Ramsaran, and Director General, Dr. Mahadio. Thank you for joining us.
Thank you very much for having us.
Okay, so first, before we begin, I would like us to reflect on the past year and the developments that happened within the health sector. Dr. Anthony?
Well, I think in 2022, we've seen a lot of developments happening in the health sector. From an infrastructure perspective, you would have seen us fixing the Diamond Hospital, Lenora, Mabaruma, Lethem. And over the past year, we also spent about 1 billion Guyana dollars fixing up almost all the health centers in the different regions. We had a special program whereby we put in waiting areas, improved sanitary facilities, and so forth. And I think a lot of people who use these services were very pleased that we were able to introduce, these additional space to the various facilities. In addition to that, we also look at training. We wanted to upgrade training for our health workers. So from community health workers right up to postgraduate training, we were able to offer it during the year. And we are working on expanding a lot of these programs. In terms of the quality of the programs that we are delivering, so let's say, for example, in chronic non-communicable diseases, we were able to change protocols. So one of the things that the ministry introduced is a program called HEARTS, where we using different medication, more updated medication, to help patients control their high blood pressure and heart disease and so forth. And this year we'll be introducing a HEARTS D. So it's it's a very dynamic ministry. We have lots of things that are happening, and it's one of the things where we want to keep expanding and improving at the same time.
Right. Okay, zooming in a little bit on the budget, right? What can you tell us about the new pediatric and maternal hospital that will be built?
So last year, we actually signed a contract to start this project, and the government has allocated 10 acres of land right near the Ogle Airport. And so construction preparing the site started last year, and you would see a lot more accelerated development during this year. The company that is doing the construction is an Austrian company called Vamed. They have vast experience in developing hospitals, and this particular hospital that we'll be building would be 256 beds, and it would have a number of subspecialty in pediatrics, and would cater for the most high-risk mothers that, persons with complicated pregnancy would be able to go there. Some of the features of the hospital would include having full diagnostic suite, a full imaging suite, and we would have a theater that is specially dedicated to pediatric cardiac surgery. So you would see a vast improvement in what we will be able to do as a country in terms of treating patients. And this hospital would not only serve Guyanese, but we feel once it's completed, with the various subspecialties, we would have a lot of people coming here for care.
Dr. Barry, any advancements that we should know about that Guyanese can look forward to with this new hospital?
Yes. Coming exactly after the minister, this might sound well. No woman should die giving life. Right? Over the years, we've been able to drop it. I don't know what is today's figure. It might be 10 or something like that. But giving life should be a joy for the entire family. So the specialty hospital and that doctor referred to, Dr. Anthony, the maternity and neonatal cases can be dealt with there, that would be a big boost. That is actually empowering women. Some women continuously lose their babies, and little specialized help can stop that. So no woman should die giving life. That's one that this budget addresses. But you might not understand the reasoning behind it, or you see it easily if you're just looking at blunt figures. So I think we should minister should be given a pat on the shoulder for exactly caring for our ladies, right? That's one. And secondly, we need to look at the proper use of the health centers. We need to magnify it. For example, should they work late in the night? You're looking at things like that because you have it's personnel. So people wanting to bring their kids, for example, to the health center, they also have to work. So sometimes they have to miss a day, right? And if we're having that service into the evenings or a little late, we need more people, more personnel. And that is exactly what this budget is doing. A massive surge in personnel training of all levels. As a matter of fact, I can tell you this. Some of the small islands in the Caribbean have heard of our programs, and they've been approaching us to send their people here to train not only as doctors at UG or nurses at the nursing school, but at all the other 20 or so different specialties, laboratory technicians and so on. So we're being big brother to the Caribbean. Guyana is very known for big brother.
Right.
And they share their skills, and they send. Of course, if they send students here, we would give them the programs free. We did it in the past. But they will have to live. They got to rent houses. They got to do things, and that will be a little boost to the Guyanese economy.
Right. So we know with all these facilities, we will need healthcare workers. How important is it that persons, take this opportunity and use it wisely?
Well, I know the ministry is on a very extended advertisement program, advertising what you can get and so on. And we have a very good complex in Kingston, right? Many people don't understand that or don't know it. They think of the nursing school as in East Street. But the main nursing school now is in Kingston, massive and well kept, convenient, having good amenities like washrooms and so forth for the predominantly nurses who are women. And Linden has one too, and New Amsterdam. Many people don't know that the Linden Training Center for Nurses and New Amsterdam. As a matter of fact, Linden has a special place in our hearts. They don't only train for Region 10, they train for the other regions. Right? And that can cause a little bother because some people would be wondering why they get in so much nurses training and then come into Linden. That's the scope of, or the remit of this school is to train, especially for Amerindian areas. Right? So that, I think the ministry should have explained that before, but I just take the little moment to explain it. Linden is doing great as far as the nursing school is concerned, but we want to say kudos and hi and hello and good things to Linden. You are not only training for yourself, you're training for Guyana, for certain regions, the inland regions. Okay.
One of the things that we will be doing this year is changing the format of how we do training for registered nurses. So the traditional approach has been a physical classroom where you go to that classroom and so forth, but that also has been a constraining factor because currently we can only train maybe about 250 persons per year, and that's not enough. So we are now going to do a hybrid system where we would use an online platform. We are partnering with Coursera, and we would migrate our curriculum for nursing education onto the Coursera platform and open that up to the persons who apply to us. This year we are hoping that we can attract at least 1,000 persons into nursing, and they would use this, the theory would be done on Coursera, and the practicals, when you need to do practicals, you come and we'll have simulation centers where you'll be able to do practicals. So by doing that, a lot more people would be trained.
Okay. And speaking of an online platform, what can you tell us about the new telemedicine facilities that will be built across Guyana?
Before I go there, if I could build a little bit on what the minister said. So what on the minister's watch, what the government would have done so far is extend training. So for the first time ever, we have nursing assistant training being done in regions 1 and 9, where they're training their own nursing assistants. And to add to that, we would have from 2020 to now, we would have added nearly 50% more nearly double the number of community health workers that we have in the system. Because in Region 9, in Region 1, in Region 7 and 8, we had facilities that had no health workers. So there were just buildings there that were being serviced by a visiting team maybe once every 3 months or so. Now each one of these facilities would have at least 2, in most cases 3, health workers there on a daily basis. Now that these regions are training their own nursing assistants, from the nursing assistants now, they'll be upgraded to go into the professional training that Minister is speaking about. So we're not only looking at today to meet the needs of today, we still have needs today, but in building these new hospitals that will be coming on stream, we'll need to staff them too, and so we're looking to the future, and this is why I think personally that the new method of training for the professional nurses is more than welcome. And it would also, persons who want to do the program do not necessarily have to be here, but they could access the program through the Ministry of Health.
And the program too, so that people can understand, there's a program that we've had for a number of years, but we brought in experts from Canada to review the curriculum that we'll be using to train. We have updated the curriculum, and we have a partnership with one of the largest nursing schools in Brazil, which is a WHO collaborating center that is working directly with our trainers here to ensure that the material that we'll be presenting online is in keeping with training in any other part of the world for this type of level. That school in Brazil had worked with nurses here to upgrade some of them from a bachelor's in nursing to master's, and in some cases even a PhD. So they would have benefited from training with this Brazilian school. And some of these persons are now the faculty that would be training online. In addition to that, we are also working with Mount Sinai, and they are also helping us to review our nursing curriculum. So we have a combination of institutions, organizations that have been working with us to make this a success. And because it would be on an online platform, once this works as we anticipate it to work, I'm sure that we would be able to extend it, as Dr. Ramsaran was saying, to countries in the region. So in some cases, they don't have to physically come here. They'll be able to log in the comfort of their own home, in whichever country, and do the course online. And if they would like to come to Ghana to do the practicals, they're more than welcome to do that. But this would also be a pioneering effort, because the 18 other programs that we have, training programs that we have in the ministry, we are going to migrate them online as well. And we'll look at other programs that we are currently developing. So for example, with the UK, we have a biomedical technician program that we're doing for the first time. We're training 40 people. And we have a number of universities that we have been working with to do different types of training.
Right. And how many healthcare workers the program can cater for?
Well, it depends which one of the programs, right? So nursing, when we expand it now, we'll be doing an intake of at least 1,000. We have put that as a limit, but we can expand that. So for quality control, we have used 1,000. The other programs, we have different faculty. And one of the things that we didn't utilize very much of was the people with the knowledge in the regions. So we have doctors that are normally in the regions. So we're now using them as part of our teaching faculty when we decentralize these programs. So prior to this, a lot of people had to come to Georgetown or come to a central site to be trained. Now we are taking the training and the faculty into the region to train people, and it's making a big difference. So we have been able to do that for community health workers, as Dr. Mahathir was saying. We have done that for nursing assistants. We are doing it for pharmacy assistants. We have programs for laboratory assistants, multi-tech technician programs and so forth. So there's a whole variety of programs and we're taking it into the region. And the good thing is that people from the different regions are coming forward and being part of the program. And when they finish their training, they'll get a job with us in that region.
Right, right.
So the telemedicine, so what Minister is saying there basically is that we're not only catering to the nurses, because a hospital needs a whole host of different specialties, and so we're building from the bottom coming up. With the telemedicine program that we have, so it caters to providing a specialist service in the remotest part of the country. So 4 facilities would have been chosen, and so if we could go where Minister launched a program in Guns, this is a community that it takes you about 2 hours by plane to get there. And from there to Lethem, which is the nearest regional big hospital, specialist hospital, if you were to come out from there by trail, by boat, by trail again, it will take you a minimum of 5 days, and in bad weather up to 10 days. But these people, they're the residents of Guns right now. They have specialists who could provide advice. So staff were trained, equipment was provided, so they could get a heart test done, they could get an ultrasound done and read in Georgetown, and advice given there. So all the specialists we have, it is interconnected. So from Guns, which is in Region 9, they could seek advice from Lethem Hospital. We have people trained there to manage the program also. And if they need super specialist advice, they could get it from Georgetown. Doctors and specialists and super specialists are always on call. And so by doing this, you could save lives. You could have timely intervention. And not only that, but you could also have timely evacuation from the facility. So let us say a patient is diagnosed with something that cannot be managed in there. Needs, let us say, theater intervention, surgical intervention, or a super specialist intervention. A timely diagnosis, a flight is arranged. It's very expensive, but a flight is arranged. The person is flown out, and a life, or more than one life in the case of a pregnant woman, will be saved. So that is a program that was implemented last year. It is working. We are working on it. It's working well. All the kinks are being removed, and it will be expanded this year. I think that is one of the programs that Minister dreamt of some time ago, and the government of Guyana, the president said, let's implement it. Another program that I'd like to talk about, by the way, that you didn't mention, is another one of Minister's pet projects, the Snap-on Spectacle Project. And this is, simply put, this is going to the hinterland, going to far out places. We were in Purima in Region 7. You go there, the specialists go there with their kit, they do a test. The patients themselves, it's a simple process where they identify themselves, what is the defect, what kind of lenses they need. The lenses are there, it's fixed onto the frame, and they're given. So they come and they leave with prescription glasses. Right?
And it takes about 15 minutes.
And I mean, you could see school children were there, and you could see they're like, it's like it's only for them to say, oh wow, I could see again.
Right.
Yeah, but it's these are may seem simple things, but make a great. Imagine a school child sitting in class, not being able to see properly on the board, cannot perform well, get 0 or 5 or whatever percent out of 100. Not because he's dunce, or as they would say colloquially, or because he doesn't have the ability, but just because he can't see on the board.
Right.
Yeah.
And this makes a difference, a future doctor, a future engineer, a future president, a minister. So this is another project that we need to talk about, because in the budget it will be expanded, right? And a lot more people are going to get it. And we're targeting last year we targeted mainly the hinterland population to provide this. So that is another project that we need to talk about, that we need to.
So when you think about how we are helping people in the budget, this has a very direct impact on people being able to see. And last year we bought spectacles for 4,500 people. And this year we have made a larger allocation, so more people would benefit from it. In the past, hearing aids, people needing to get a hearing aid, that would have cost them 65,000 Guyana dollars. We removed the cost. We've been distributing, of course, checking the person to see that if they need the hearing aid, calibrate the hearing aid and giving them free of cost. Last year we distributed about 500. This year we're hoping to expand that to about 1,000. There are quite a few people because, let's say, complication of diabetes, they've lost a limb. Now, if they have to replace the limb, let's say below the knee, they had a below the knee amputation, it probably would cost them maybe $300,000 to $400,000 for a prosthesis. This year, we're making arrangements to be able to do that free of cost for people. And that's going to be a big thing for people because a lot of people, once they have an amputation, it's hard for them to get a job.
Right.
And with the prosthesis, they'll be able to function almost as normal.
Right.
So this would be a new program that we're putting in place. We actually make the prosthesis in the ministry. We have a workshop where that is done, and we are going to expand that, and we're going to make it free for our patients. So there are lots of programs that would have impact on people, making their lives better. And this is one of the features of the budget that we really want to emphasize because it really has a big impact on people.
Right.
Like the, sorry to put it, Minister,
Sure.
but like persons with cataract who are literally blind living in some remote village somewhere. We know, just to backtrack a little bit, when we came back into office in 2020, end of 2020 basically, the ophthalmology hospital had not been functioning for about 5 years. No surgeries being done except for one visiting team that came in from America and brought everything themselves. The ministry invested over $100 million in equipment alone and a lot more money to redo this facility's infrastructure from Ministry of Health and from the region to get that facility working. And I'm happy to say that last year we would have done over 1,200 surgeries, among which all the cataract patients that were identified. So we took a team into Region 9 to identify all the eye problems that were there. All those identified with cataract, pterygium, and that needed laser surgery. At the cost of the government, the Ministry of Health paid, brought them out, took them to Port Moran, got their surgeries done, got them sorted out, took them back in there, and then after 30 days, when they needed to be having their final check, we took in the ophthalmology team in there, got them checked right and let them, and they're okay. As we speak now, today, we are doing surgeries with similar patients from Region 1. That will be completed by Saturday. We would have completed Region 2. So this is, like Minister is saying, this is having a real impact on the people who are affected the most. Most of those patients that we brought out, they knew they had an eye problem, but they would have never sought help because they couldn't afford it.
Yeah, and the range of service is very diverse. So we spoke about the snap-on spectacles. That's a very simple procedure. So we were able to do from the simplest to the most complex. So apart from doing glaucoma, the surgeries for glaucoma and so forth, one of the things that we have been doing at the Georgetown Hospital is do transplants for cornea. And this is a very complicated thing, and we probably have done more than 100 and something corneal transplants at the Georgetown Hospital. And that was possible because we have passed legislation to allow for these types of transplants. And very soon, during this year, we're hoping to set up our own eye bank so that we can harvest corneas right here and be able to do the transplants. Another big project that had a big impact, I think, for patients last year would have been implants that we were able to do for patients. So we had a team from Operation Walk Maryland that came to Guyana, and we did in one weekend 52 surgeries, where persons got new knees, new hips, and I think that really made a tremendous impact on those persons who received them. We have now, we have had worked with the team to develop an agreement where they'll be coming every year to Guyana. They'll teach and they'll operate. And so now, persons who would have otherwise suffered with knee problems and they probably, if they had the money, they would be able to, go overseas to get this type of surgery. We are going to be able to do that surgery routinely at the Georgetown Hospital. And, this, again, is making a tremendous difference to people's lives. So we are addressing not just primary health care, but we are also addressing the more complex types of surgeries that people would need. And talking about telemedicine, Dr. Mahadev spoke about the type of telemedicine where we do consultation with patients that are in remote areas. But we have also been working on other modalities of telemedicine. So, for example, we have teleradiology. So a CT scan taken in New Amsterdam, if we don't have a radiologist there, we can interpret that CT scan at the Georgetown Hospital simultaneously. So you send the image, it's interpreted, results go back. And this system that we are building out, because we are now putting in all digital x-rays, early this year, let's say in the first quarter of this year, there'll be at least 13 digital x-rays that would be placed at different regional hospitals, and the interpretation of those images would be done by the Georgetown Hospital. In another 2 years or so, there'll be about 9 CT scans that will be placed at various regional hospitals. And again, the images would be interpreted at the main center. So teleradiology is a way of us getting high quality interpretation of these imaging results. We've also been doing teleophthalmology. So for diabetic patients, one of the things that they need to do is a scan of their retina. And every diabetic patient should have that at least every 2 years. Earlier would also be maybe once a year. But because we don't have enough persons to go and do the ophthalmology services, one of the things that we are now doing is setting up these centers in different parts of the country to offer these services. But when the scan of the retina is done, it's interpreted centrally. And this year we are working to offer a very different type of telemedicine service that is called telepathology. So if you take a biopsy from a patient, we prepare that biopsy, take a high-resolution image of the specimen, and just like a CT scan, a pathologist would be able to look at that and interpret that image and determine what type of cancer or it's non-cancerous or things like that. So that's a service that will be implemented this year. Right now, for some of our pathology services, it probably takes months to get back the results. The turnaround time on this would be probably a week. So it changes the whole dynamics, and then therefore it would greatly improve diagnostics for certain category of patients. So there are lots of interesting things that are happening in the health sector. And again, it ranges from some simple interventions to the most complex interventions.
So Minister,
If I can
talk
comment
a
here
little
quickly,
bit
Vish.
about the NICU.
The diaspora, they're going to be excited. They have so many Guyanese in second generation who are trained technicians and doctors and so on. They will be very happy with what this budget is doing. I think they go to other countries and give their services. Some come to Guyana too, but sometimes they're frustrated because we don't have the basics. And I think this budget is putting that in order. Oil and gas might be one of the flags that bringing them here to see how things happen. But the children and especially migrants who become doctors, so they're willing to come back. the diaspora. So we need to put a plug for them. They're doing a good job. Frank is very knowledgeable about this. He probably is the driving force now. And more universities are wanting to come. You know, some of them thought Guyana was in Africa, right? Now they know better, right?
Right.
So that's, and the next thing about them coming, once you have the equipment and you have the commitment, and now you're having communications electronically, you know, you can send over the pictures or the images from the patients before they come. And I think that's going to be a big squirt. We're not recognizing it. And it's not only foreigners who are coming here from but actually people born and bred in Guyana and grew up overseas, right? So that's something you got to look at. Incidentally, the nursing school, 1,000 souls are going to be trained also. You could imagine this has increased from about 40. That has increased from about 46 a few years ago, 45. That is why it was a correct move to have nursing school in the night. You know, there was a big hullabaloo. You might not have been around. Why are you training the nurses in the night in Kingston? I said, well, don't they work in the night? You know, so we always have, not only in the government but mostly outside in the wider society, some naysayers. You know, so we're happy that now we have started, not started, but it started how many, 10 years now? Training in the night nurse, and they're doing fairly well. Again, you have Caribbean Islands, the administration want to send in nurses to do that. So we must be doing something good. If they're stealing our nurses, one of the biggest things, you know. So what we're hoping to do with that experience, say, look, don't steal our nurses. Pay us to train your nurses, even if it's some Guyanese. Right? So I think that's another good thing this budget is preparing. It's preparing the infrastructure where we reach out to the diaspora and to such people who need to be serviced.
Right. Thank you, Dr. Berry. Thank you, Dr. Anthony. And thank you, Dr. Mahadio. Everyone kind of understands now what the budget, the direct impact it has on Guyanese and the major advancements in the health sector. So thank you so much for being a part of this discussion today.
It was only now warming up. This got to be part one, eh?
We can have you back.
When is part two?
We can have you back.